There are a number of people presenting today. We aren't going to do introductions in the beginning. We will introduce ourselves as we go along. Again, my name is Darianne McCormick. I work at the Department of Human Services in the Child Safety and Family Preservation Unit under Rebecca Wilcox, who is our first presenter today. We do have a couple of points that we will stop and ask for questions. Feel free to put questions in the chat along the way. We do have someone monitoring that, and then we can try to address those when we break for questions. We also, all of the presenters were provided with copies of the questions that you all sent in when you registered. So thank you for doing that. Here you'll see the desired outcomes of today's training. And again, really this is focusing on the prevention services side of Family First, and then Minnesota's Title IV-E prevention plan. So we aren't going to get into the residential services side of Family First or the QRTP process, qualified residential treatment program for qualified individuals. I did send out emails for those areas. I sent those out last week, and they're also included at the end of this webinar under resources. We also will not be getting into kinship, the kinship side of Family First Prevention Services. And again, there are some resources at the end of the PowerPoint where you can go to learn a little bit more about the kinship navigator program under FFPSA. Okay, so without further ado, Rebecca, go ahead and take it away.
Good morning, everyone. My name is Rebecca Wilcox, and I'm the manager of child safety and prevention here at the department. And thank you all for coming today. And thanks, Darian, for the opening. And just want to acknowledge that there's still a lot of unanswered questions as we move along, so that we're hoping to get to a lot of the questions that you've submitted via email. But again, we're still working on the implementation part of things. So there are a lot of questions that we still have that we're still working on. So just wanted to add that, but please do continue to submit your questions, and we'll take those and respond post webinar. So Family First Prevention Services. So we know that this passed a few years ago. It's a federal law that changes the way that child welfare services are provided. It is designed to prevent removal of children by helping parents and families connect to essential services that help them maintain safety and stability within their own homes. So Family First allows states to access federal 4E funding, reimbursement to prevent removal of children by connecting families to services, evidence-based services. Family Prevention Services is a part, as Darian mentioned, of FFPSA, and it includes a number of elements, evidence-based services in a few categories, and we'll get into those categories a little bit later. So we'll discuss each one of these components, so eligibility, services, and the evidence criteria connected to those services throughout today. The goal of prevention services is to support at-risk families through services and to allow children to remain home and safe with their families. While prevention services under FFPSA is optional, states that do opt in are required to develop and submit a 5-year prevention plan. Minnesota did submit our plan in September of 2022, so last fall, and it was approved earlier this year in January of 2023. Prevention services under FFPSA is only one piece of the puzzle when we think about the continuum of prevention services in Minnesota. This particular continuum diagram is also found in a prevention plan, and Darian, I'm not sure, we sent them a link to the plan itself online. If we haven't, we sure will ensure that you have a link to that. The continuum diagram, excuse me, Pardon me. The continuum diagram maps out the range of how we think about prevention services across the continuum. So prevention services generally is that placement prevention strategy. So on that farther end, in that fourth bucket, the darker green on the far right. However, prevention services should be part of comprehensive cross-cutting system, which is demonstrated by this diagram. So there's multiple strategies related to prevention. Prevention service is just one of those strategies on sort of that deeper end or the intervention component. The agency, us, TRDHS, have multiple other strategies that um, uh, we're working on currently or concurrently with prevention services. So again, just one of those strategies. In our work so far on prevention services, we've arrived at some common goals to achieve, or some common values to achieve our goals. We know that children belong with their families, and the child welfare system has an obligation to support and partner with families, communities, organizations, and systems. We know we work best when we use a family-focused or family-first approach. Children are not unique; they are within families. So, family first is that approach that we're taking. Center equity in the practice. So FFPSA is not necessarily an equity approach, and so we have to make sure that equity is centered in our all of the things that we're working on under Family First. And we ensure coordination, collaboration, innovation, and family preservation service delivery. And we want to make sure that the child welfare workforce is prepared and supported to do the work that's important here under prevention services. Our goals related to prevention services include the following, and also outlined in our prevention plan. Include improving the health and well-being of families, reducing maltreatment, reducing entry and re-entry into our foster care system, address and eliminate disproportionality across our system, strengthen and support our workforce, and create an accessible and sustainable system of family preservation that strengthens families and improves our outcomes. Our vision for prevention services is to create a strong initial foundation of prevention services tied to transformation. Continue to expand the number of services that we have on our plan. Continue to collaborate with families and our system partners to do that work. Using CQI as a way and a mechanism to continue to monitor, strengthen our programs and our services and workforce. And continue to coordinate outside of prevention services, right? Again, this is just one bucket of prevention. So what are our other prevention strategies to help build and meet families where they're at, no matter where they might touch the system, and maybe even before they enter the system, right? That's the ideal. Our plan. So as previously mentioned, Minnesota, we submitted our plan last fall. States were required to include a number of elements in their state plans, which includes the state's candidacy definition. So we get to define our own definition of candidacy for prevention services. Services that state plans, services that we intend to include in our state plan and submitted for reimbursement. We included motivational interviewing and parents and teachers. And we'll cover those in greater detail later in the presentation. We were required to identify a continuous quality improvement evaluation strategy, and workforce support and training strategies are also outlined in our 5-year plan. The plan development was a multi-year process, including a few iterations of structure or governance. This diagram here shows the final structure in which sort of the plan was submitted under. We'll discuss the current implementation structure later in this work group. And again, this is all new and trying to figure out the best way to approach the work to allow the most voice into the process as we move forward. For FFPSA candidacy, there are several requirements tied to the federal law itself, not necessarily to state law, but again to the federal law, which create both opportunities and challenges for implementation. These requirements include a risk and safety element. They must be monitored continuously throughout prevention services. A child-specific prevention plan must be created for each candidate. Children may be served for up to 12 months without a redetermination, but after that, eligibility must be reestablished. Finally, multiple data, child-specific data reporting elements are required under prevention services, including tracking post-service delivery or post-case closure. Well, there's opportunities which include really prevention, right, of removal from children from their families, provides financing for specific evidence-based services. The development of additional services can contribute to not just support families in our child protection system, but outside of our child protection system. And really an opportunity to think about a practice shift and increased focus on child safety within their own homes. And of course, with opportunities, there's sometimes challenges that we face when implementing something new. These include that requirement that families be monitored under a prevention plan. Of course, this brings the concern around over surveillance of families that can lead to deeper end involvement. Also, there's some challenges with the evidence-based service requirement. There's limited services available on the Family First Clearinghouse, which is the requirement. There's lack of culturally relevant services, and the federal requirement related to evidence-based services rather than evidence-informed is also a challenge and barrier for states, including us. The current eligibility definition was created under that plan structure, under the work group structure that was shown just a few minutes ago. So that there's a subwork group that worked and analyzed the data to determine which children in Minnesota were at the highest risk of entering out-of-home care. That language is part of the federal law. So states could define their own candidacy, the language under the federal law is who's at most risk of entering care. So that data that the work group analyzed led to this particular definition that is our current candidacy definition. So a child must be the alleged victim in the screened-in child protection report, have an open child protection case management work group, and meet at least one of the following criteria. So previous out-of-home care, identified need for child protective services at the case closure, alleged victim in a previous maltreatment report, have allegations involving caregiver substance abuse, child behavior, or mental health concerns. And there's one exception. So all these kids that I just mentioned, right, now have to be with their families. The one exception to that is that a youth is expected for parenting and in foster care. So that's the outlier, that orange bucket that you see. In addition to the candidacy, right, I mentioned earlier that the plan development also included service selection. At this point in time, we've selected motivational interviewing parents as teachers as the first two prevention services. Here we are on our implementation timeline. We're in the implementation phase of prevention services. This timeline depicts where we're at currently. So you can see that we started in this particular timeline and submission approval last fall. Did start implementation planning late last year as well. You'll see that eventually we'll move into future service exploration, our CQI process, and in the actual implementation of motivational interviewing and parents as teachers, and then ongoing implementation. And so we'll continue to cycle through. As we add more services to our plan, we'll continue sort of implementing, releasing, going through this process as we move forward. While we've been making a shift for some time, prevention services is an important marker in child welfare law and practice. It expands a program that historically only allowed reimbursement for foster care and adoption. So the reimbursement, now we can move that for reimbursement further upstream. Prevention services goes beyond an opportunity for funding. It creates the opportunity for practice and system transformation. Prevention services allows us to put our values into action to strengthen families and prevention of out-of-home placement and using foster care only as a very last resort. This practice transformation further emphasized the importance of family preservation, centering the family in decision-making, Collaboration with other family members can support people and system providers and sets a very high bar for removal in foster care. This practice transformation starts with you in the workforce and also us at DHS, of course. Well, the department will be providing training specific to family first prevention services, including motivational interviewing training, which we'll hear about later in this presentation. Additional efforts to support and equip the workforce is underway. The department, together with others, have been developing a child safety framework, including the safety practice profiles to help strengthen safety assessment and planning, ongoing safety assessment throughout the life of the case. The safety practice profiles have undergone 2 pilot phases here in the state, and efforts to finalize fidelity monitoring plans are underway. More information will be provided in the coming months about the safety framework, the practice profiles, and how it all fits together with prevention services and this practice transformation that we're creating. And with that, that's the end of my presentation, and I will turn it over to Megan Senni.
Hello, everyone. I am Megan Senni. I have been working closely with others and other state and local agencies and individuals to identify which services should be on the prevention plan and now implementing the services that are on the prevention plan. So I will be talking about those specifically today. And you can go to the next slide. So I'm going to share an overview of what is required under Family First for the individual prevention services, and then we'll talk more about the selected services on Minnesota's prevention plan. So for each of the individual services under Family First, they must be trauma-informed, it must be evidence-based, to identify which services meet the federal definition of evidence-based. The Title 40 clearinghouse was created by the Federal Administration for Children and Families. This clearinghouse reviews programs and services and approves programs that are eligible under Family First. And I'll talk about that process more in the next slide. The services must fit into one of the 3 service categories of mental health, substance abuse, or in-home parenting skill-based programs. And the studies must show positive impacts of the service in at least one of the target outcome areas, really child welfare and safety, permanency, child well-being, or adult well-being. And then lastly, the services must be on the state's prevention plan. And so I am going to spend some time touching more on what the evidence standards are that are used to review and approve programs. Each program, again, is reviewed by the clearinghouse, will receive one of the ratings, one of the 4 ratings that are in the colored boxes. The programs that are reviewed will either be determined to be receive a rating of does not currently meet criteria, or promising practice, supported practice, or well-supported practice. And I'll provide a high-level overview of that process. Anyone may submit a service to the Title 40 Prevention Services Clearinghouse. At least annually, they do a public call for programs to review. Again, the services must fit into one of the service categories of mental health, substance abuse, or in-home parenting skill-based programs. The programs must be clearly defined and replicable, and how they determine that is the programs must have a written protocol or manual or documentation describing how to implement and administrate the practice. They must target the outcomes, again, in the domains of child safety, permanency, child well-being, or adult well-being. The services must be in use and active. Once a service is approved to be rated by the clearinghouse. The clearinghouse will then review evidence that is available for that program that may be submitted along with the program. They also do literature searches. They also look at other clearinghouses, such as the California Evidence-Based Home Clearinghouse. And after the research is reviewed on that program, that is when the clearinghouse will rate the programs and when they will receive one of these ratings. Again, programs that receive a rating of does not currently meet criteria would not be eligible under Family First, but programs that are rated as promising, supported, or well supported would be eligible to be claimed under Family First, as long as the other requirements are met, which we will talk about more today. And services can be reviewed to receive a higher rating, for example, and this is an ongoing process. One important note here is that this process does create barriers for more community-based programs and for populations that or in Minnesota experience disproportionalities, such as American Indian or African American. This whole process is very westernized and again creates barriers. The evidence standards take time and both resources to complete the studies and to get the programs approved. And their definition of evidence may not match the evidence that is defined by the clearinghouse, which leaves out many culturally relevant practices or traditional prevention practices, such as those used by Native communities. So now I will talk about the services that are on Minnesota's prevention plan and how those services were selected. There was a work group process to select the services on Minnesota's plan, which looked at which services are being used, are eligible under Family First. We looked at areas of accessibility, the lack of culturally responsive services on the clearinghouse was taken into account. And the work group identified services in other ways, such as getting expertise from work group members or looking at national data on diverse populations. And for how can services be added to Minnesota's prevention plan? Again, this is the only first service array of the first plan that has been submitted. States are allowed to resubmit their prevention plans at any point, such as to add additional services. And Minnesota will be doing that. That process has not yet started. The process of looking at future services to add to the prevention plan. We are currently still implementing the 2 selected services. Okay, so now I will give a brief overview of the 2 services that were selected on Minnesota's prevention plan, and what they are, why they were chosen, and the plan for implementation, which is currently being planned through work groups, and then where we're at in implementation planning. So both services, the 2 services that were chosen are Parents as Teachers and Motivational Interviewing. Both services were chosen because they are already being provided in Minnesota, found to be effective with diverse populations, have some flexibility in how they're provided. There was a potential for expansion seen through Family First. They met the needs of the eligible population, and were rated as well supported, which allowed for Minnesota to request an evaluation waiver. And lastly, because there was a potential for claiming, as we started to look at services, we learned that many of the services we were looking at were already largely being supported by the Minnesota's Medicaid program. And Medicaid's the payer of the last resort, meaning if Medicaid paid for a service, then 4E would not kick in. So that was another factor that was used when looking at services. So start with parents as teachers, or can you go back to the last slide? So parents as teachers is an in-home home visiting program that uses visits, group connections, resource network, and screening methods to support families and improve positive parenting practices. This service was chosen for the reasons already named. Also, there was a need for, expressed a need for an in-home program. Parents as teachers was also chosen because of the minimal educational requirement for providers or the home visitors, which are called parent educators, have a minimal educational requirement of a high school diploma, which differed from other home visiting programs that we were looking at that required nurse home providers. We're also seen as a potential for expansion through Family First because Parents as Teachers is a newer program to Minnesota, not as widely available. And lastly, because there were many of the required fidelity monitoring, continuous quality improvement, and implementation support that's required in Family First is already being provided and in place for the affiliates. The plan for implementation, Parents as Teachers will be implemented with the existing affiliates initially. There are currently 13 in Minnesota. On the next slide, there we'll show a list of the current Parents as Teachers sites. Parents as Teachers will not be available statewide. Initially, many of the Parents as Teachers sites are in the metro area. And again, initially we're looking at implementing Family First with the existing sites that choose to implement the Family First changes. And in the future, we'll look at expansion. You'll see that there are currently no child welfare agencies that are Parents as Teachers affiliates. They are mainly public health or nonprofits that are currently providing Parents as Teachers. Currently we are looking at which of those sites will be implementing the Family First changes. And then for motivational interviewing, this service is motivational interviewing is a client engagement tool that promotes increased engagement and supports intrinsic motivation to change. The spirit of MI core skills and fundamental processes are all focused on partnering with individuals being provided MI, strength focus. MI, the goal is to implement with it MI as a tool for workers to use when working with families to increase engagement in services and safety planning. MI was chosen because it's a service that could be implemented more statewide. It is already being used widely, such as in corrections. However, it's not clear if agencies are all using the specific model approved by the clearinghouse. The plan to implement MI The major distinction is that MI will be implemented so that caseworkers will be providing motivational interviewing to parents or caregivers. And Renee Armstrong from the Training Academy will be speaking more to what that process will look like. We are currently working with the Training Academy, the Center for Practice Transformation, and the Tribal Training Certification Program to look at implementing motivational interviewing.
Thank you, Megan. I'm Renee Armstrong, and I'm going to be sharing a little more details about the implementation of motivational interviewing here in Minnesota. As mentioned, the supervisor of the training operations and policy at the Academy, and excited to have been in collaboration deeply with our partners with the Center for Practice Transformation, as mentioned, along with involved with the work group, implementation work group as well. So as mentioned, we are working with the Center for Practice Transformation, who have an expertise in motivational interviewing, to really develop the curriculum and offer our initial delivery. And those trainers and developers have national certification in motivational interviewing, which makes them well equipped to support this effort, and are also doing a lot of work in some analysis and research with other states in the implementation of motivational interviewing, specifically for child welfare with other states. So they've been carrying out that research, partnering with our partners at TTCP, the Tribal Training Certification Partnership, and working with our curriculum developers here at the Academy to ensure that the curriculum aligns with looking at our own competencies, aligning with instructional design best practices and child welfare as well. And of course, to ensure that Minnesota motivational interviewing meets evidence-based practice MI fidelity while taking into account the unique needs and specific specifications of Minnesota child welfare practice. What are the real goals that we have in Minnesota to ensure that we're supporting the most equitable outcomes and make a transformational practice happen? So in this slide, I'm going to break down a little bit of the core components of our implementation. It's really comprised of what we see as like 3 kind of required steps that will be taken consecutively. And that starts with an initial introduction to motivational interviewing, the self-paced workshop in that first bullet. And the workshop begins with it's asynchronous, which means kind of a self-paced, on-demand introduction to motivational interviewing that addresses its foundational principles, its relevance to child protection, and provides an overview of the training and certification process and requirements. Following that, the motivational interviewing skills live workshops, or virtual workshops, excuse me, those are, like they say, they're in person, kind of like this, and they're virtual. And so our trainers will be leading those in real time with workers and supervisors taking the course, professionals in the field that will focus on developing motivational interviewing skills as identified as particularly relevant and useful for child protection workers and their clients. So each virtual workshop is chunked into 3.5-hour segments that are spaced 1 week apart over 4 weeks to allow for in-session practice. And that's what we know, of course, makes the biggest impact as adult learners, to ensure that we are taking in information, practicing it a little bit, and coming back together. The workshop segments are focused on skill development and practice. So that kind of takes that into account as well. Following that, you'll see the coaching circles, and the coaching circles are a fundamental part of effective motivational interviewing training. So to be certified, participants will need to attend a minimum of 4 distinct coaching circles within 6 months of completing the workshop. So that allows lots of time, and I'll talk about that in just a minute in terms of a timeline for completion. There is some flexibility. There's a lot of flexibility there. But essentially, there'll be coaching circles offered practically weekly to many every month that folks can plug into as it works for your schedule. And as more trainers qualify, the number of circles will increase, and as more workers are in training, the more circles that'll be available. So essentially, folks will take those coaching circles that will be really focused on individual practice, demonstration, role playing, and feedback. And as mentioned, that's a really a foundational element of motivational interviewing, as it's a real tenet of not just learning a new content, but really learning a new skill and a new ethic of practice. And so part of that is truly to be able to practice that, get feedback, step more into that principles of motivational interviewing, and support that practice ongoing. And then the initial assessment. So this is the evaluation of a participant's skills and in really completing a minimum kind of competency that we're setting for the state for the child welfare certification for motivational interviewing. So that will take place, and it's a pretty brief assessment. It's about a half hour that folks are engaged in. And so that will be an opportunity for folks to take part in that. So to be certified, participants will demonstrate proficient use of specific motivational interviewing skills by responding to simulated scenarios, and participants that don't pass initially have the opportunity to retake that assessment. And if they need to, they can go back and attend some coaching circles or follow up and take part in more training to support their skill building as well. Let's see. And as we've mentioned a little bit, so and I'll show as well, we'll be having a pilot delivery phase that will begin this August for the initial 6 months of delivery. And so that way we'll be learning a lot about that experience of taking on the training, the experience of you and your teams, and making sure that we can make that as smooth as possible. As mentioned, there's lots of flexibility in how or when and folks can take the training and how the timeline for completion. If your staff have the time to take it and the investment of kind of taking it in more of a condensed route, part of that is that folks could really take this within kind of fully complete the certification process in 2.5 or 3 months to carry out the live virtual workshops, the coaching circles, and take the assessment. If that's not quite feasible for your team or your staff, you're able to space that out, and they can plug into coaching circles at a lesser frequency. And we're asking that folks and our teams take workers complete that process within 6 months to make sure that skills are built upon, still fresh, and they're able to take that assessment by really building off of the skills and information they've gained. So as mentioned, lots of flexibility in that timeline for completion. And I would say, again, what we're looking at is ideally, within a few months, but up to 6 months to complete that, just based on schedules and capacity for folks to plug into training. A big part of our implementation planning and work has been a lot of collaboration. So as mentioned here, just building upon the discussion that started, of course, there was identification for motivational interviewing in that early part of our planning efforts. And as we were greatly involved with the implementation work group and collaboration with our training partners with the TTCP to ensure that as we look at implementing evidence-based practice, we're doing so in a very forward-thinking, proactive opportunity to assess what is it that we really want to focus on. What goals and outcomes do we have in Minnesota? What's unique in Minnesota to meet? What are some of the opportunities to build upon within our current training? And that's where some of the opportunities to really hit partner with our tribal and training certification program was really greatly embraced. We have a lot of opportunities to ensure that workers across the state are able to understand and see and connect how motivational interviewing aligns with their current practice and how it can enhance and refine their practice as well. So we're excited about that and excited about the opportunity to do that. As mentioned, the phase 1 of the pilot delivery will start in August for the first 6 months of that initial delivery to really assess how things are going, how the curriculum is hitting, how the registration process is for your teams, and also just looking at the whole picture. There are some, in terms of, some of the questions that are very, maybe, how do folks kind of plug in? What do folks need to know? So as a specialized course, we consider this a specialized course. workers or staff, anyone taking this course, essentially are just required to have completed new worker or what we call currently foundations training, which includes, as many folks know, a series of classrooms and an ICWA-MIFPA course offered by TTCP. If your staff have completed new worker training in the last 3.5 years, they've met this requirement. So many of your teams are probably ready to plug into this training, which is fantastic. TTCP also offers regular ongoing ICWA-MIFPA training that your staff or yourself can plug into and take to meet that requirement as well. Supervisors are exempt from the new worker training prerequisite. So if this is something you're ready to sign up for, that new worker training is not a requirement for you as a supervisor to take. However, you would need to complete the ICWA-MIFPA training before, during, or within 6 months of workers starting the motivational interviewing training. And all of that information we'll be making sure that'll be shared in the next kind of month or so as we set out, and we'll have some registration information available for the first initial cohorts. Again, we're excited to make sure that this can be an offering that you and your teams can plug into in the time that it makes sense for you, whether it's August or in the next year or whatever makes sense. We have also made some decisions about for those agencies who have had previous training in motivational interviewing, acknowledging that and recognizing that. So for child welfare professionals with previous motivational training, if that's an agency priority that you've been able to invest in, essentially one must complete or have proof of the ICWA-MIFPA training and have proof of completed motivational training within the past 2 years, or proof of, so showing the evidence of that previous training. And then essentially either complete the initial assessment or proof of alternative competency evaluation completed in the last 2 years. As folks who perhaps have already training in that motivational interviewing, which is great, you also have opportunities and are very welcome to also take the coaching circles. We want to make sure that's an offering and an option for everybody to really enhance and refine skills, whether you're a supervisor, director, or a worker as well. So the coaching circles are open to everyone, and we're encouraging folks to plug into those, whether you've had previous training or not. I think that hits most of what I was going to cover. As mentioned, there's a few things that we're still looking forward to making sure we're aligning as we continue on with that phase 2 and ongoing training and fidelity monitoring piece. Those are things we'll be making sure we're connecting on and tying together in our partnership with Center for Practice Transformation, and of course our teams who are working hard at making those definitions within the DHS as well. So when it comes to those pieces, as we look out to phase 2, we'll be making sure we're making those alignments within training so that supervisors, directors, workers know what's expected and can support your teams within that space as well. So I'll pause there for questions. I think looks like we might have a couple in the chat.
Yeah, Renee, I don't know if you can see the chat. I can't see the chat, so I'm just going off of what I'm seeing other ways, but there are a couple questions specific to MI. One of the questions is, can you restate what workers who completed foundations 3.5 years ago need to do to get into MI certification?
Oh, great question. Yep. So if workers have completed foundations more than 3.5 years ago, what has been an update is that currently workers are taking this ICWA-MIFPA course that's specific to ICWA-MIFPA practice within Minnesota. And that's something that's truly a foundational element that is been added. And so that would be the prerequisite requirement. So, and that is offered almost weekly by TTCP. And so there's offerings there. We've been partnering quite a bit with them, and they're ready to increase those offerings if needed. So that would be the only prerequisite for folks who have completed foundations more than 3.5 years ago.
Okay,
And
so
it
to
looks like-
clarify, sorry, there are a couple more questions about like staff who've been working, for a long time. So they don't have to redo foundations. They
Oh,
just have to
absolutely
take
not.
that ICWA,
Exactly.
and then the MI certification.
Correct. Yep.
Okay.
Good clarification. Yep. Thank you.
Darian,
Okay.
I think, do you want me to, so we had another question. Is motivational interviewing needed for all children's staff or just CP? The trainings talk about specific CP staff, but it's my understanding that all children's staff need to comply with FFPSA requirements.
Yeah, that's a good question. So in the beginning of the presentation, you heard me talk about how there are multiple sides. There's, the residential services side of FFPSA. And so in that realm, yes, absolutely, that applies to all children's services when it comes to out-of-home placement, QRTPs, a qualified individual process, or specialized settings. When it comes to prevention services, and that side of FFPSA, currently, right now, what has been approved in Minnesota's 5-year plan is that prevention services applies to those children with an open child protection work group. So earlier you heard Rebecca talk about the candidacy and who is eligible for prevention services. So currently it is specific to children with and families with open child protection cases where those children remain in the home with their families. And then that caveat of the pregnant and parenting youth in foster care. And so hopefully that answers. If that doesn't answer, feel free to add it in the chat. I also want to, Megan can speak to some of the other questions that came in a minute, but I want to highlight one of the questions that was sent during the registration process, a couple of the questions. So how can staff be eligible to provide this service? So that's the area that Renee just covered. So those child protection workers, those child protection case workers who will be working with families where children are being provided with in-home child protection case management. And then the second part of that question was preventing out-of-home placement should be for all ages. Will this focus on that? And I want to say absolutely. Motivational interviewing, not only is it a technique that is it's a great resource and technique to use with parents, but think of those older youth. Think of the children and youth who are, really resistant to talking with the social worker or meeting with the social worker. And we know that those youth do have higher rates of, they can have higher rates of out-of-home placement. Prior to my work here at DHS, I had a very specific caseload of working with adolescents who've been trafficked and exploited. And motivational interviewing is one of those techniques that just really could help engage those youth and work with them on setting their goals and getting them involved in the case planning process. So I completely agree that preventing out-of-home placement should apply to all ages. And I think that's one of the great things about MI. And so at the end of the webinar, I will go back and talk about MI a little bit. And there are a couple of resources that are linked in the PowerPoint that talk about applying MI to when working with child welfare. Okay, Megan, I am going to pause there and let you address the questions that came in earlier. I know that they're in the chat, but just for purposes of this recording, I want to make sure that we're catching it verbally as well.
Darian, we had a couple quick questions with MI related.
Oh, okay.
If you want to, okay, so, and Renee, you might be able to answer. How recently does the ICWA MIPA class need to have been done? And how do we have proof of attendance for that?
Sure, good questions. I was just typing that in the chat. Yeah, if folks have taken and completed the ICWA MIPA class offered by TTCP, they've met the requirement. They've only been offering that in the last 2.5 years, I believe. So if if folks have taken that and have taken it from TTCP, that they've completed that, met that requirement. And to do, let's see, if they've taken it, they would have, they would have evidence through their training portal. So that way they can look it up and be able to have that on their training record through Canvas, through the learning management system, through the training academy. So if you have questions about that, or if you're not sure if your staff have taken it through TTCP, feel free to reach out or chat with them or have them kind of reach out, and we can confirm that and make sure that you have what you need, or if you need additional dates to connect folks with. And I hope that it was clear. It looks like, I just want to reiterate that we're not asking that folks that who've been in the field for many years retake foundations or new worker training. We just want to make sure that folks are kind of updating themselves to the newer, not extremely recent, but the newer requirement that really serves as the foundational prereq for this offering as a specialized class. So I wanted to make sure that was clear.
There was one more about MI, and then I'll answer another one, and then I'll hand it over to Megan. So Joan asks, will workers be required to take MI training through the training academy, or could they get the training through another source that would meet the requirements? And I think that that's something that you've been trying to come up with a plan on, Renee.
Yes, good question. So we have met and discussed this quite a bit. We do recognize, as mentioned, that there are some regions or agencies who've had some previous training in motivational interviewing. Of course, the tricky part that we want to make sure we have a sense of is some consistency, right? Because making sure that folks are able to meet the essentially a minimum kind of competency for our practice, and particularly Minnesota's child welfare practice for motivational interviewing. So as mentioned, and we'll get this in some written communication as well as I speak to it, it might be harder to follow, but as mentioned, folks have previous training in motivational interviewing that we are able to, folks are able to show that proof of completed training within the last 2 years. If it's been longer than 2 years, staff would be expected to take the training over again, show proof of refresher within the last year, or again, take the training that's going to be offered through the academy. However, if you've had staff that have taken training within the last 2 years, you're able to show proof of that from June 1st of 21 to June 1st of 23. We're able to capture that, recognize that, and then be able to honor that. We'll be offering that a way for folks to upload that to show that you've completed that training. And then, as mentioned, staff would be able to have access to coaching circles as options, and then be able to either take, of course, the initial assessment for kind of an advanced track for that initial assessment. If folks have proof of alternative competency in the last 2 years, then that would be something we'd ask for evidence of as well.
And then Jesse asked the question, and then I will pass it over to Megan. So there was a question on, are counties required to provide placement prevention services, PAT and MI, and create PACE plans for all children eligible, or for only those that are receiving 4E reimbursement being sought for? So to answer, so I'll talk a little bit about PACE plans later on. So our service plans will be redesigned, and basically the plan will meet the requirements for FFPSA prevention services. And so you will have child specific goals within the plan, but it's not going to be specific. Like you're not gonna have to do multiple plans for multiple children. So whether or not they're eligible and receiving a service, what the service plan is going to remain the same. And then And then there's the eligibility process that will have to be documented within SSIS. And so, in the beginning, we know that not a lot of children are going to be eligible and receiving the service. But the goal really, especially with motivational interviewing, is to get to a point where all of child welfare workforce are trained in motivational interviewing and providing that as a service in their everyday work with families. Okay, and then Megan, I am going to turn it over to you for the couple of questions I think that came in regarding PAT in the very beginning. If you want to just reiterate those questions.
Yes. So just reiterating, it's not expected that every county is going to implement parents as teachers, but the goal is for motivational interviewing to be implemented statewide. And then I was just going to retouch and make sure that the question on if there are pilot counties chosen already was answered, which Renee already answered. And it's more of a pilot period, and there won't be specific counties that will be piloting motivational interviewing, but it'll be open to counties that are able to meet the prerequisites and other requirements in order to implement or become certified in motivational interviewing. And then I'm going to go back to the questions that were asked in the chat and also answered about parents as teachers. The first question was, are the private nonprofit agencies being talked to see if they want to provide parents as teachers, and will candidates be aware of the outcome of these conversations? The answer is yes. There are 2 of the parents and teachers affiliates are part of the implementation planning work group that is currently in place. And the next step that we will be doing will be engaging with the remaining parents as teachers affiliates to see if they're interested in implementing the Family First changes. And yes, there will also be engagement with the county child welfare agencies where parents as teachers is available. And then for the second question, is it intended for county staff to receive parents as teachers training so they can also claim for a reimbursement? So that will be explored during the expansion after the initial period of implementing parents as teachers with the current affiliates. We are exploring all the various ways how that will work and how Family First can support the existing programs. There is a process to become a Parents as Teachers affiliate through the Parents as Teachers National Center. I would encourage any interested counties to look at that process. And I can share the link in the chat to that. But I also wanted to note that we will continue to explore additional services that are eligible under Family First, which may include other existing home visiting programs. But yeah, again, I can share the link to the Parents as Teachers National Center who do the affiliation process. And then there was another question, follow-up question. Do the agencies have the capacity to provide parents as teachers to all the families? So that is something that we are looking at and have been discussing in the work group, such as if there would need to be additional capacity added so that they are able to serve the potential increase in number of families directly from increasing referrals from Family First. So that's something that we are continuing to look at.
Megan. I know a couple of other questions have come in, and some specific to claiming, which we're going to talk about in the next section. And so I'm gonna just hold on those questions, and then we can come back to them at the end if it's still not clear. I will say, you know, with 4E and claiming, there is still a lot that we're working on, and that a lot of states are working on in the implementation of prevention services with Family First, and that you know, this is a new process also for our federal partners. And so they have limited guidance for us right now, and we are, you know, we're continuing to work on figuring out how everything is going to be in place and work. And so I'm going to move into the next section on claiming, and that will cover some of those questions. Okay. Oh, slide didn't advance, did it? Okay. So FFPSA has created a pathway for child welfare agencies to receive partial Title IV-E federal reimbursement to support certain evidence-based practices, which were described in the first half of our presentation. And for those, it's for those children who meet the state's candidacy definition, which we talked about, which includes an open child protection work group where the children are at home with their parents. And so it's to meet the state's candidacy definition and to prevent entry into foster care. And so when we hear prevention services, we know that can sound different for different people. And you know, what is true prevention? What FFPSA is in Minnesota is prevention into foster care. The federally approved prevention services that we've been talking about include motivational interviewing and parents as teachers. The department has, been working on multiple elements that have to be in place to ensure that we're able to submit claims on behalf of counties and initiative tribes. These include 4E administrative claiming, services claiming, and 4E training related to prevention services. So there was a question earlier around whether or not there would be claiming allowed for that requirement of the ICWA-MIFPA training. That's a great question, and something that we will certainly be bringing back to our team as we work on this implementation process. The work is complex and new. As I said earlier, our federal partners have never done this before. And you know, the state of Minnesota has not done this before. We have been consulting with other states to support our development here in Minnesota. And what we've heard over and over again from other states is that this is a complex process. So we appreciate your understanding and grace as we work to put all of these pieces together for our implementation of prevention services here in Minnesota. So as you see here, this slide, I'm not going to read it, but it outlines some of those administrative costs that are associated with reimbursement when a child is eligible for prevention services and they are receiving prevention services. Okay. And then this slide covers what needs to be in place for Title IV-E prevention services reimbursement. First and foremost, there has to be that federally approved 4E prevention plan. Ours was submitted last fall and it was approved in January here in Minnesota. And then only those services that are on the plan are approved for Title IV-E reimbursement, along with some of the administrative costs that were mentioned on the other slide. There has to be an eligibility determination in place. for prevention candidacy, and that will be completed in SSIS by agency staff. There has to be a case plan documenting what services the family will receive. So if they're receiving PAT or participating, in case management services and receiving motivational interviewing, those will be outlined within the plan and then also documented in SSIS. There has to be a 4E reporting and claiming process in place for local agencies and initiative tribes. And as I mentioned earlier, there's multiple elements to that to ensure that we're able to submit those claims and receive the reimbursement. The SSIS work, the development has been one of the major focuses that I actually personally have been working on. As part of the requirements for e-claiming. And we're really working diligently to minimize those changes in SSIS, but there will be some. We are, sensitive and aware of the fact that staff have already a lot of responsibilities and requirements, especially within SSIS. And so we're really trying to automate what we're able to and streamline the process for agencies and staff. The specifics of how to claim and to submit to the department will be laid out in the coming months. We don't have those answers yet. Again, this is the first really statewide prevention services trainings that we are offering. What we've heard throughout the implementation process is that people want to know, what to expect. They want to be planning and prepared for it. And so we're doing our best to get the information out as it comes along, but there will be further trainings in the coming months to cover some of this information. There are multiple considerations to take into account when we think of the timing and when counties and initiative tribes might be able to claim. This includes necessary changes to SSIS, the rate ratio setting, and considerations regarding the state's cost allocation plan. And so the cost allocation plan is another thing that has to be in place in order for reimbursement to happen. Our cost allocation plan was submitted earlier this year, but has not been approved yet. And the department will continue to provide information as it relates to the timing. In the meantime, what folks can do to prepare is that once that motivational interviewing training is available, it's important to have staff trained who will be providing case management and support through prevention services and preventing out-of-home placement for those families open with child protection. That's having staff trained in motivational interviewing. It really is one of those big, important first steps, not just for claiming, but to achieve the vision and the goals of what we in Minnesota have set out in our 4E prevention plan. And then I want to take a minute to just touch on other funding streams. We know that oftentimes children might be receiving child protection case management, and they also might be receiving children's mental health case management. So there could be a dual case management role there. And then there's also CWTCM, child welfare targeted case management, which children might be eligible for as well. And so both of those are also federal funding sources and cannot be claimed at the same time for the same child. In addition, the traditional Title IV-E foster care candidate, that eligibility may overlap, but they cannot be claimed simultaneously. The claiming decisions have to be made on a case-by-case basis. And then on this next slide, you'll see this is from familyfirst.org. This is in your PowerPoint, all of the links, all of anything that's hyperlinked here, you'll be able to access through your PowerPoint. So if you wanted to take a look at this, this graphic a little bit more in depth and to read a little bit more about prevention candidates and traditional candidates, you can access this site. This just shows that, like, this is here in Minnesota, we have traditional candidates and we have prevention candidates, and then we have children receiving in-home services. So all of those children receiving in-home services may have traditional candidates and prevention, or sorry, there may be overlapping qualification, or they may be overlapping in their definitions. Okay, so now I'm going to pass it on to Jennifer Dronick to talk about the CQI process.
Thanks, Darianne. So I'm part of the continuous quality improvement section here at the department. So I'm going to run through this quickly. We're running short on time, so there's a federal requirement that all prevention services plans need to have a continuous quality improvement plan that includes how implementation of services or programs selected will be continuously monitored to ensure fidelity to the practice model and determine outcomes achieved, and how information learned from monitoring will be used to refine and improve practices. So we developed a continuous quality improvement plan. Fidelity monitoring is just ensuring that when it's put into practice that workers are implementing the model as designed, which helps us say whether or not that model is achieving the outcomes that we are looking for. So we have to have a rigorous evaluation plan for each service and then an overall plan for the prevention services. There's a slide that I think we passed up, Darianne. If you want to go back one, that's our logic model that basically defines specific goals and target outcomes for each of the selected services. The model demonstrates how selected services will meet the prevention plan goal of preventing children at risk of entering foster care from actually entering out-of-home placement by building a comprehensive prevention continuum able to meet the needs of children and families. Department staff have and will continue to work with key partners at local, tribal, and state levels to develop and implement the CQI process as outlined. So if you just go from left to right on that slide, starts with the target population, which was talked about earlier, the inputs of the two services that we've identified and will be implementing in Minnesota. The outcomes are the third box from the left, and talk about what we can expect to see when we implement these with families. So our short-term outcomes, and then hopefully the plan is for these long-term outcomes to come to fruition, which is the furthest right box. So Darianne, you can go to the next slide. So Minnesota's Child Welfare Continuous Quality Improvement Team will provide both quantitative and qualitative data to monitor and understand the impact of parents as teachers and motivational interviewing, what the impact is on the children and families receiving the services, as well as the workforce. Data collected will monitor both those the short-term and the long-term outcomes, as well as fidelity to each of the models. Quantitative data is generated through selected data fields in SSIS. Some are currently available and some will be integrated, and we'll be able to visualize them through a Tableau dashboard. Qualitative data will be collected through case review processes, surveys, mappings, focus groups, and observations. Qualitative data will be coded and analyzed using an in vivo software to identify barriers, facilitators, gaps in practice, practice drift, and other themes with potential impact on identified outcomes. Barriers, facilitators, gaps, drifting, and other themes will be provided to and feedback received from implementation teams, service providers, participants, and workforce for further analysis to determine what, if any, additional learnings are needed and identify areas for improvement to better serve children and families. So I'll just, finish there. Thank you.
You. And I just want to acknowledge that we have about 11 minutes left. And I know that there are still some questions coming in, so I'm going to breeze through this part a little bit. A lot of it I've already covered, and then try to make sure that we have time at the end for questions. If there are questions that we did not get to, we certainly can follow up on email as well. So we've talked throughout the presentation this morning, we have talked about the workforce development. And as you know, prevention services as a whole, you know, there is a training implementation team that is focused on how we can best implement and provide information for agencies and the workforce as we move forward with prevention services. So we want to make sure that our webinars are easily accessible. This webinar will be recorded and shared to the Academy's website. There will be some sort of brief training on eligibility determination for prevention services, and that will be an on-demand training once it's developed so that staff can access it on their own time. The motivational interviewing training, and then eventually all the information on FFPSA prevention services will be integrated into that new worker training and supervisor training. For prevention caseloads, there is a focus and a recommendation for there to be you know, a recommendation of 12 cases per worker as they're providing in-home services. We acknowledge that that might not seem achievable for some agencies. We know that there are staff shortages, and that, you know, one of the things that we're really hoping for is with motivational interviewing, it provides tools and support too to not only agency staff but also supervisors. You'll see a shift in the language that we're using here in Minnesota when we talk about child protection and really focusing on family preservation. Workers, you might hear family preservation workers used as a title for child protection caseworkers or case managers. And then as I mentioned earlier when we were talking about motivational interviewing during the first break for questions, these are the resources that I was referencing that are really focused on motivational interviewing in a child welfare practice and setting, and the benefits of that. Of using that strategy and tool. Throughout the time that I've been involved, over the last 3 years that I've been involved with prevention services implementation, things that I have heard over and over again from folks participating in the work groups is, and so agency staff, so staff and supervisors, is really focusing on that need to improve family engagement. And in turn, that can reduce disparities when we think of children placed and out of home placement. And so motivational interviewing is you know, identified as prevention services to increase family engagement and improve family-centered service planning. And like I said, this is a tool. It's not only for parents, but also can be, you know, just a great skill to have when working with children as well. We talked a little bit earlier about the SSIS changes. These are still in the works and under development. There will be a new service plan that will be for child protection caseloads. You'll see it as a family support plan in SSIS. Once we know more about that release, and we will make sure that we're updating all of you to plan for that process. There will be the eligibility determination that will happen in SSIS, and some brass code changes as well. And all of these changes are, you know, under development between the department with SSIS and Minute as well. And then so for next steps, we will continue to offer webinars. But there is another webinar coming up on June 13th that is focused on direct folks in the field providing direct case management and support to families. And if you don't have that, information was sent out when the information for this webinar was sent out, but if you need that information to have your staff register for the upcoming webinar, please feel free to reach out to me and I can send the announcement to you. keep your eyes out for motivational interviewing training. Again, we'll let you know as we know more with that changes in SSIS and how to determine eligibility. And then if you haven't signed up for the e-updates for FFPSA prevention services, please sign up for the updates so that you can get information as it is distributed. And so on this last slide, or one of the last slides on the resources, you will see right here where it says subscribe to Family First Prevention Services Act news and updates. There's also several other resources. So the county link site, you will find information not only on prevention services, but you'll find information on residential services, the QRTP process. You'll also find information on kinship, the Kinship Navigator program, and that is also linked here. And then we have 5 minutes left for questions. I know that there have been some that have come in. On the last page, you will have all of our email addresses. So if there are any additional questions that you didn't get to ask right now, feel free to reach out to us with any other questions. Okay, so I'm going to pause here and see what we can tackle for questions.
Ariane, you might want to. Sorry, I'm echoing. There's one on what's going to be covered in the staff training, and will it be the same as this one?
Oh, that's a good question. You know, I'm actually meeting with our training implementation team right after this meeting to talk about that a little bit more. I do think that there are some, you know, I don't know that we have to go as in depth on claiming topics and maybe some of the more technical sides of it, but the information will be similar. We just may not cover, I think, claiming as in depth, but that we're going to talk about that in our team. Okay, what other questions do we have?
So we do have a lot of several claiming questions that may need to be followed up with follow-up email and that we might not have time to, so we can do a write-up maybe with some of these questions. But one that Megan answered regarding parents, teachers. Megan, do you want to read that one off regarding youngest children?
Yeah, the question was, or well, PAT is, and said PAT is really only focused on the youngest children, and so the findings about those interventions will be limited. And I answered yes, so the eligible age for children, children are eligible prenatal up until kindergarten entry and may enter the program at any point during that time.
And can you also reiterate, you had answered the question about 2 PAT affiliates in the chat. Do you want to reiterate that here?
Yes, the question was which affiliates are part of the implementation work group. The 2 affiliates are Scott County Public Health and Lutheran Social Services, who serves Ramsey County. And then I also noted that because they're in the work group does not mean that they will be participating in Family First, or that's not something that's decided, but they are part of the work group, implementation planning work group.